Hi, everyone, and welcome to our new monthly member spotlight. We are thrilled to launch this series where we'll be highlighting a member from our incredible society each and every month. We'll be sitting down with a different member, trying to learn about their journey, celebrate their accomplishments, as well as explore what drives them. Before we jump in, let me introduce myself. I am Tabarak Qassim. I am a resident doctor at Cambridge University Hospitals in the UK. And today I've got with me Christy. Christy, would you like to introduce yourself, please?
Sure. Hello, and thank you for this opportunity. My name is Christy DiCristofano, and I am the lead oncology massage therapist at City of Hope with the Churn Family Center for Integrative Oncology.
Very nice to meet you, Christy. So, I'd like to know what exactly drove you to get involved in integrative oncology.
That's a great question. I started my journey as a massage therapist around almost 15 years ago now, and I just started out doing massage for Parkinson's and cancer patients and hospice end of life patients. And that kind of evolved as I started to learn more about integrative oncology and what that meant. And it's interesting when you look up the word integrative on Google, it says to combine, to unify separate things. And I just think that's so important. I know we have other definitions of integrative oncology, but I just think it speaks volumes to what we want to do for integrative oncology and for our patients, is we want to unify all the different opportunities those patients can have to help with their treatment before, during, and after their cancer journey.
Absolutely. Thank you for sharing that. This leads perfectly into our next question, which is the impact you've had on others. Could you please tell me a little more, a brief story about a patient or a caregiver that you've helped using IO therapies?
Yes. We started a pilot program at City of Hope offering massage therapy, hand and or foot massage during chemotherapy infusion at City of Hope in Orange County. And the difference in impact it had on the patients was amazing. It even affected their caregivers. It was like a ripple effect. Just the caregivers were so relieved to see that their loved ones were being comforted and some of their symptoms were decreasing. So a lot of the patients during chemo have anxiety, they have neuropathy, they have nausea, depression, so many symptoms that go along with that phase of their journey. And the massage helped decrease each and every one of those symptoms. And to the point where at times a patient's blood pressure would be high, and a nurse would ask me to do a hand or foot massage for the patient, and their blood pressure would come down to normal parameters that they could receive their chemo. And that just made it a more comfortable setting and space for that patient.
Wow.
Along with doing it in infusion, I know it was exciting. Along with doing it in infusion, we also offer a massage clinic, and we have patients that have obviously cancer, but they have other issues too, like fibromyalgia. And a patient was really nervous about getting massage because every time she's had massage before, it's made her worse with the fibro. And we were able just to talk through and take her massage session very slowly and carefully and just do the massage very lightly so that it not only helped with her cancer symptoms, but it also helped with her fibro symptoms. And then that just gave her something to look forward to. And she left and came back for another session. And she said, I've not felt this good in, I can't remember the last time. And so that those are the stories that I think about how we can help all these patients that are going through what they're going through.
Wow, it's truly powerful. And I love the fact that you've highlighted the impact of your work directly on patients and their caregivers. Now, I'd like to talk about the people who have helped shape your journey. Who has influenced your integrative oncology work and how did they influence it?
Yes, mostly it's been the patients.
Mm.
Each and every day, spending time with them, seeing how this massage does impact them and how it helps them to feel better and the difference it makes in their life mentally, emotionally, and physically. And as far as me personally, just each and every day, I try to make a difference in their lives. And a lot of it goes off of what Mother Teresa always did to help the sick and care for the needy. And so I just think, what can I do better today that I didn't do yesterday?
Wow, that's honestly incredible. And I always remind myself that the most important member of the team is the patient himself.
Yes.
Thank you for so much for sharing that. Now, looking ahead, what excites you the most about the future of this field? Where do you see integrative oncology and cancer care evolving within the next 10 years?
I would love for massage and all other disciplines of integrative oncology really to become the standard of care, where when you sit down with the oncologist and they offer, well, we have to do chemotherapy, we have to do surgery, we have to do radiation. Then they also say, and along with that, you can do massage therapy, music therapy, acupuncture, mindful meditation. So we're thinking of the patient as a whole. And with that, we thankfully just got our final IRB approval to do a research protocol for massage during chemotherapy infusion to check the anxiety levels and to see if massaging different parts of the body during that infusion session will decrease their anxiety more than others. And I think that's just going to open the door for the massage field even more. There is research on massage therapy, but I think this is just going to help add to that. And I would just love to see this to become a standard of care for patients so it can make that difference and it can help them on a journey that they did not sign up for, but they're sure struggling with.
Wow, congratulations. And
Thank
hopefully,
you.
hopefully this accomplishment is the start to many coming. That's a perfect and inspiring note to end on. Thank you so much for your time today, Christy. Thanks for sharing your story and insights with us. It's been a pleasure speaking with you. That's all we've got for today. We hope you enjoyed getting to know Christy, our featured members of the month, and we hope you tune in next month as we feature another inspiring and incredible member of our society. Thank you so much for your time, everyone.
Thank you.